Just as adults, children also may suffer sleep apnea, often demonstrated by daytime tiredness and irritability. They may demonstrate regular snoring, choking, or apneic episodes at night as well. Some children may have significant nasal obstruction and mouth breathing. The tonsils and the adenoids are the main reasons for obstructive breathing in children. The tonsils are located on the sides of the throat, whereas the adenoids are located at the back of the nose. In adults, the obstruction can occur in many other levels and often more complex than in children. The other indications for removed tonsils are recurrent bouts of tonsillitis. Another reason would be one-sided enlargement in tonsils to ensure there is no growth within the tonsils. Some children with adenoidal enlargement alone may demonstrate regular nasal discharge or nasal obstruction that may require adenoidectomy alone. Adenoids are once again located at the back of the nose. Surgery is performed in a well-equipped hospital with modern equipment. Adenoid surgery can be done as a day operation, whereas tonsillectomy as an overnight stay. On the day of surgery, you will accompany the child to theatre until the child falls asleep, and you will go to the recovery area where the surgeon will come and talk to you after surgery. After surgery, tonsillectomy children will be admitted to the ward for observation and nursing care, and a well-trained team of staff will look after your child. When they sleep, we'll monitor their oxygen to ensure there's safe recovery. You'll be provided with guidance and care throughout the night as well as in the morning by your surgeon. In order to reduce the pain and bleeding, we use a technique called coblation, which is a low heat device, also called a plasma knife. It produces approximately 40 degrees of Celsius heat as opposed to 400 Celsius by diathermy. In experienced hands, it reduces bleeding as well as pain. We use the same technique for removal of adenoids, which reduces the risk of recurrence or infection as opposed to the traditional scraping of the adenoids. After surgery, parents need to be aware there are certain risks with surgery and how to manage. This includes pain, bleeding, as well as a very small risk of hemorrhage that may require the child to be readmitted to an emergency ENT hospital. We advise against any long distance travel up to 3 or 4 weeks after surgery. Very rarely, people can get bruising of their gum or the teeth or even jaw joint pain. Those are rare risks. Risk of permanently altered voice or taste or swallowing is an extremely rare risk. Risk of life-threatening events have been recorded in documents or in publications, but those risks are not that dissimilar to the risks you take going on a long road trip. The best way to manage your child and yourself after surgery is to be aware on how to look after yourself before and after surgery. For this, we will provide a 4-page document. The first page tells you how to look after yourself before surgery, and the second one tells you how to look after surgery, including how to manage pain and discomfort. The third page gives a summary of the risks that we have described. All this will be provided by a surgeon should your child require surgery. In addition to this, you'll be also provided with a College of Surgeons document that describes things a bit more in detail, but we find the summary document is all that you need for good understanding. Once again, just as adults, children may suffer sleep apnea as well. There are indications for adenotonsillectomy in children as well as in adults. Often the surgery is carried out in a safe manner with the best possible techniques in a safe environment.